So here we are now on the screen. So I've got the ultrasound on the patient's tummy, and we're now looking down from the skin all the way down to the deep abdominal contents. And with the patient here, you can just see that she's breathing normally, and we're just seeing the movement of the layers. So starting at the top, we've got the skin, then the subcutaneous layer, or the fat layer, or the cream on top of the cake, which is very, very minimal on this client. Then we have external oblique, say that one again, internal oblique, and then this thin, deepest layer of muscle here, the transverse abdominus. We can't see the outermost layer of muscle, the rectus abdominis, because that's further round into the center of the abdomen. Remember from the previous video, I'm out around the side of the tummy, and so these are the depths of the layers. So we're interested in this deep transverse abdominal muscle, and its action is to thicken and gently slide around the abdominal wall. And on this screen, what we should see when I ask the patient to gently tighten is that this muscle will thicken slightly, but it will move across the right-hand side of the screen, and that's the effect of the muscle tensioning on its attachment, on what we call its fascial attachments, all the way around the abdominal cylinder. So first of all, I'm going to ask the patient to do what we would consider a poor contraction or an incorrect contraction. So just tighten and brace for me. Okay, so what we've seen here, hold, and let go, is that we've seen all the muscles tightening and thickening. The transverse abdominis thickened, so did the internal oblique, and so did the external oblique. The transverse abdominis did not slide around to protect the back of the back and the spine. Okay, so now this time what I'd like you to do, Christina, is just continue to breathe normally if you can, and then when you're ready, I want you to gently just try and tighten your deep, low tummy. Hold, and now relax. Let go. So what we see there is we see the thickening of this transverse abdominal muscle, and it's moving from its resting position there around towards the spine. We do see a thickening and a tightening of the internal oblique, and they often co-contract together. What's really important is that this internal oblique does not take over the effort from the transverse abdominis. So again, as you gently continue to breathe, just try and draw that muscle in around towards your spine. Hold it there, and continue to breathe. Gently holding it, so we've got a thickening here, it's working around the side. Keep gently breathing, holding the contraction, and now let go. Relax all the way. Thank you. Good. So with Christina, we do see some internal oblique, and providing, again, that doesn't dominate as we continue to do exercises, that's fine.